So, we might as well start with the big one, healthcare.
Oh, that one.
Oh, that one. So what will have to happen in order for you to support the bill? I mean, what's happening with it right
Sure.
now? All of that.
Well, again, first of all, I think there's been some misunderstanding of what I did last week. I never said I wasn't going to vote for a bill. I just said I'm not going to vote this week. I just said I'm for sure no on the motion to proceed. It was just way too soon. We got a discussion draft. The American people saw a discussion draft for the first time. Didn't get the CBO score till Monday. Way too short a time period to really break it all down and fully understand it. So that was the only thing I said I was a no on. What I've been trying to focus on, primarily in imperfect piece of legislation, is we have not done enough to bring down premiums. And I mean gross premiums, not after subsidies. If we can bring down the gross price of premiums that have been artificially increased because of all these market reforms under Obamacare, this architecture that's caused premiums nationally on average to more than double, in many cases triple. We ought to be able to bring those things down. If we do that, now the people that Bill Clinton was talking about, the people out there busting it, working sometimes 60 hours a week, premiums have doubled, coverage cut in half, those individuals now be able to afford health care. And the cost of subsidies, the American taxpayer will also decline without harming those individuals who are being subsidized. So we got to focus like a laser on bringing the price of gross premiums down, and you do that with root cause analysis in terms of what caused them to double. Sometimes people say, "Well, would you want to go back to the way it was before Obamacare?" Yeah, where premiums are half to a third of where they were today. You bet. Mm-hmm. I would happily go back to that imperfect system, build off of that versus the mess we're facing right now with these Obamacare markets collapsing.
Can you talk about the CBO score of 22 million would lose health coverage? Is that what they said?
Well, let's break that down. So CBO said the first year, 15 million would, primarily because we've eliminated the individual mandate, so people in freedom are saying they're not going to buy unaffordable health care. But of that 15 million, 4 million supposedly are people that are getting Medicaid free of charge, and CBO says 4 million people getting free health care are going to drop it just because the individual mandate goes away. I don't know. I suppose so. Another 4 million are because the loss of the employer mandate, they lose group coverage. That's more plausible. But then the remaining 7 million, CBO has, we're using a baseline from March of 2016, a year and 3 months old. CBO has a revised baseline in terms of number insured on the individual and non-group market from January 2017. It's the exact same number of insureds as in the Senate bill. So if you compare it against that baseline, there's no difference. So from 15 million goes down to a more plausible 4 million. And so you have to really look carefully at those CBO numbers. No, nobody wants to pull the rug out from under anyone, and I really don't think we are. If individuals in freedom say they can't afford insurance, so they're not going to buy it, the solution is bring down the premiums, which gets me back to my main effort here is to bring down the gross price of premiums.
The other concern might have been that because Wisconsin didn't take the Medicaid expansion, right?
Well, I'm highly concerned about locking in that disparity between responsible states like Wisconsin, who do a really good job managing their Medicaid population. And by the way, we're the only state, because of Governor Walker's leadership, state legislature, we closed the Obamacare coverage gap caused by the Supreme Court ruling. We close that here in Wisconsin. We've got, according to the Wisconsin Department of Family Services, we've got 96% of Wisconsinites covered for all or part of the year. That's pretty good. Prior to Obamacare, it was about 94%, according to that department. So we didn't need Obamacare kind of screwing up our individual market, disadvantaging those individuals that don't get subsidies that can no longer afford coverage.
And the bill would penalize the state for that, or?
Well, I'm afraid to lock in the disparity.
Oh, okay. And has there been some attempt to?
We're trying. I literally just got off a conference call with a group of governors organized by Governor Walker. So we're having those discussions.
Okay. Let's move on to the tax code. As you know, President Trump's one of his signature campaign promises was to reform the tax code. A lot of senators and representatives have said that that's next after Obamacare repeal. Where is that right now in the discussion phase, or?
Well, the first thing we tackled was beginning to undo the regulatory burden. And we're making progress on that. And at least the private sector realizes they've got a president and administration that's not going to continue to overregulate, that they're going to have to not be looking over their shoulders, looking at new regulation that's going to cost them, more than they can afford. So we've attacked that. We're working on a really difficult problem with healthcare. A lot of us are working on taxes already. The House has got a plan. President Trump has the outlines of a plan. I've got a plan that's actually gaining a fair amount of traction. It's really focused on the corporate tax return. It's people starting to write about it. We're starting to get scores, which is a good sign. That means it's definitely a legitimate plan. But basically, what my plan does, I'm calling it a true Warren Buffett tax. There are a number of economists who say that the burden of the corporate tax doesn't fall on the piece of paper that's a corporate charter. The burden falls on employees with lower wages and benefits and consumers and higher prices. So my concept is, rather than have employees and consumers pay the corporate tax, let's make the owners pay the tax. Let's make Warren Buffett pay his fair share of his proportional share of earnings of the stocks he owns at his marginal tax rates. There's a lot of benefits to doing that. You eliminate the double taxation of dividends for a more efficient allocation of capital throughout the economy. Because LLCs and Subchapter S, and by the way, 81% of businesses in America have their income taxed just like this. LLCs and Subchapter S, their worldwide income is taxed. So you've eliminated the barrier to the free flow of capital across borders, and the plan scores with a better benefit or a larger percent benefit going to low-income individuals versus high-income. And it makes sense, because the way you collect the taxes through a 25% backup withholding paid for in the federal government. So if you're a taxpayer with a 10% tax rate, you'll get attributed $100 worth of income, $25 in taxes already been paid, but if you only owe 10%, you'll get a $15 refund. Warren Buffett will have to kick in more, which means Warren Buffett will put pressure on those corporations paying more dividends. And so low tax rate paying taxpayers will also be beneficiaries of more dividends flowing from corporations. So there's a lot of benefits. I had one of the big four accounting firms run this up their tax department. Their feedback coming back was, this is a really elegant solution.
And have you talked to the president about it? Or?
Oh yeah, his people, Speaker Ryan, Chairman Brady, Chairman Hatch, they all know I've got this Plan B, I'm calling it, the true Warren Buffett tax. I've been talking to Democrat senators, liberal economics professors. There's a lot of support for this.
Bipartisanship in Washington.
That's what I try and do. Listen, as chairman of my committee last Congress, didn't get reported much, but when all is said and done, after the election, the lame duck, and when we got a total of all the bills that we passed and were signed into law, it was 49.
Wow. So then, as a follow-up, what needs to be done? And I know you talked extensively about the deficit before. What needs to be done to reduce the deficit? And do you favor a constitutional convention to require a balanced budget amendment?
Yes. Now, not a constitutional convention, a convention of the states.
But an amendment?
Two different things.
Okay.
Constitutional convention opens the whole thing up. That would not be a good idea. But a convention of the states to take up one piece of one amendment. And from my standpoint, I prefer a constitutional amendment to limit spending as a certain percentage of GDP, as opposed to a balanced budget amendment. The problem with the balanced budget amendment is it'll have all kinds of waivers in case of emergency. All of a sudden, everything becomes an emergency, and we stop doing it. Yep. A spending limitation, I think, is far more enforceable. So that's the one. If I were in charge of the effort, I would do a spending limitation amendment. Mm-hmm. But the other thing you have to start doing is start making these entitlement programs sustainable, which is what we're trying to do by taking the management of Medicaid, devolving that to the states, providing either per capita funding caps or block grants. States will just manage it far more efficiently. They have greater flexibility to be able to take care of the citizens of their states instead of having to be imposed on them a one-size-fits-all model, which truthfully disadvantages states like Wisconsin that do a good job managing it.
And you have innovation at the state level where you probably wouldn't have that at the federal
by far
level. Yeah.
And then when you have 50 experiments, you can see what other states do. They may pass a law and people realize that worked. And when you've got a model that works, what might have been politically difficult to pass, but now you got the added evidence that it actually worked, it's going to be a whole lot easier to pass in other states as well.
building the wall. That was another one of President Trump's big promises. There's been some discussion, or at least that I've heard, with Senate Majority Leader McConnell and House Speaker Ryan, that they promised the wall will be included in a continuing resolution that's due at the end of September. Have you seen a draft of the resolution, and would you support it, and why? Or why
Well, there'll be some funding. Listen, this comes squarely under my committee's jurisdiction in terms of authorization, as well as oversight of the Department of Homeland Security and General Kelly, who'll be charged with securing our border and building whatever infrastructure we're going to build. He was before my committee probably about a month ago, and was asked the question about a wall, and he very upfront he said, responding to the Senator, nobody's envisioning a wall from sea to shining sea. What this administration has made is a commitment to secure the border, enforce our immigration laws. And we're going to secure the border with, yes, some additional wall, improving wall that is inadequate in some places, technology, greater manpower. So, to me, the wall always was, and the Secretary, I believe, the wall was really a metaphor for the commitment to secure the border, which we must do.
But you haven't seen a copy of the continuing resolution or any funding level?
No.
Okay. Then another Trump campaign promise entails crumbling infrastructure, highways, interstate highways, bridges, overpasses, with healthcare reform and tax reform taking some revenue off the table. How do you think Congress is going to fund that? And do you see a federal gas tax increase funding it? I mean, what's the talk in Washington about that?
One of the about two or three things that has unanimous support in Washington, D.C. and Congress is the need for more infrastructure spending, and you identified that the big problem is but how are you going to pay for it? From my stand, first and foremost, if you just take a look at the Highway Trust Fund, about a $15 billion per year shortfall. Our budget is approaching $4,000 billion per year. I would look for $15 billion of lower priority funding or spending to fund that. Yeah, that ought to be easy, and trust me, with the GAO's duplication report, you can find $15 billion. That'd be the first step. I know this administration is looking for more innovative ways to use public-private partnerships. They call it P3 funding. Because there, again, you're going to have far more efficient and effective spending if you've got private sector cooperating with the public or the federal government participating with states. So right now, the whole discussion, everybody wants to spend money on infrastructure. How do you pay for it? How do you fund it? And I think there are a number of ways of doing that.
But that's way back on the priority list, do you think?
Hopefully not. No, again, the number one priority of this administration, certainly from my standpoint, is economic growth. So that's why you first attack the easiest thing, at least stopping the overregulation, hopefully start reducing the regulatory burden, then tax reform as you're working on infrastructure plans.